Hepatitis B, presented by Terry Lauren, WisCon consultant. Hepatitis B morphology and distribution. Hepatitis B virus, HBV, is a member of the Hepatnaviridae family, has a circular DNA genome that is partially double-stranded and partly single-stranded. It is comprised of a number of clinically important viral proteins, including the envelope protein, hepatitis B surface antigen, HBsAg, hepatitis B core antigen, HBcAg, and a soluble nucleocapsid protein, the hepatitis B E antigen, HBeAg. 8 genotypes of hepatitis B virus have been identified, A to H, that show differential geographical distributions and clinical outcomes. For example, genotype B and C are prevalent in Asia, while A and D are more common in Europe, the Middle East, and India. And A and C are the most common in North America. Hepatitis B morphology and distribution continued. Sources for exposure to HBV are blood, cerebrospinal fluid, saliva, semen, synovial fluid, breast milk, bile, feces, nasopharyngeal washings, peritoneal, pleural, pericardial, amniotic, and unfixed tissues and organs. Contaminated surfaces. HBV can survive and remain infectious on environmental surfaces for at least 7 days. There is a potential for HBV infection via aerosols, needle sticks, or mucous membrane exposures to blood that might contain HBsAg. The rate of HBV infection have been reported to be several times greater in laboratory and hospital staff than the general population. Hepatitis B disease and symptoms. Acute hepatitis B infection may be asymptomatic or present with a clinical picture varying from mild to severe hepatitis. Persons with symptomatic acute HBV infection can show signs and symptoms that include nausea, abdominal pain, vomiting, fever, jaundice, dark urine, changes in stool color, and hepatomegaly or splenomegaly, as well as signs of liver dysfunction. The outcome of acute HBV infection is usually good with complete recovery from any liver damage and seroconversion with antibodies to hepatitis B, HBAB, which represents a long-term protection from HBV infection. Hepatitis B disease and symptoms continued. Chronic hepatitis B infection is the persistence of hepatitis B surface antigens, HBsAg, for more than 6 months. Persons with chronic HBV infection may be asymptomatic or may suffer from symptoms such as fatigue, anorexia, nausea, abdominal discomfort, and liver dysfunction. They are at substantially increased risk for developing chronic liver diseases, including cirrhosis of the liver and primary hepatocellular carcinoma. Hepatitis B transmission and incubation. HBV is transmitted by percutaneous or mucosal exposure to infected blood or other body fluids. HBV transmission has been observed with numerous forms of human contact, such as perinatal, mother to child, household, non-sexual, sexual, needle sharing, and occupational health care related. All persons who are HBsAg positive are potentially infectious, and blood can be infectious for several weeks before the onset of clinical symptoms. Incubation period is usually 45 to 180 days, average of 60 to 90 days. HBsAg can appear in as little as 2 weeks or up to 9 months after exposure. Disinfection and treatment of HBV. HBV is inactivated by formaldehyde, glutaraldehyde, sodium hypochlorite, bleach, quaternary ammonium compounds, and alcohols, 70 to 80%. It can be inactivated in boiling or chlorinated water. HBV is sensitive to antiviral drugs that are licensed in the U.S., such as interferon alpha, pegylated interferon alpha 2A, lamivudine, adafovir, entecavir, telbivudine, and tenofovir. Hepatitis B immunoglobulin, HBIg, provides immediate short-term protection against hepatitis B infection. HBIg has large amounts of hepatitis B antibody taken from donated human blood. Effective hepatitis B vaccines are available, such as Recomnavax HB. Vaccination against HBV is part of routine infant vaccinations. Sources of information on the internet. One of my go-to places is the Canadian Safety Data Sheets regarding pathogens. There is a great deal of information and one of my favorites. The NIH has a website and articles on hepatitis B, and the CDC has also information on hepatitis B.